Did you know that hospitals spend maybe a third of their entire budget just on admin, just paperwork and coordination?
It's pretty staggering when you think about it that way.
Yeah, billions of dollars every year. Money that could be, saving lives, funding research, or maybe just making your next medical bill something you can actually understand.
Exactly.
So today we're going to peel back the layers here. We're looking at how artificial intelligence, AI, isn't just like a sci-fi thing anymore.
Not at all.
It's quietly working behind the scenes, transforming the very backbone of healthcare, the admin side.
That's right. The less glamorous side, maybe, but incredibly important.
And you're about to find out how these huge financial drains are being, well, plugged, and what that means for you, the patient. We're diving into this side of AI in healthcare that, honestly, 99% of people, they never think about it, but it directly shapes the care we all get. So, yeah, get ready for some surprising connections between data and, well, your health.
It's a crucial link.
And let's be honest, we've all been there, right? Trying to book an appointment, it feels like solving some kind of, I don't know, bureaucratic riddle.
Oh, yeah. Phone trees waiting on hold.
Exactly.
Yeah.
And then you get the bill, and it looks like it's written in hieroglyphics or something.
Completely indecipherable.
Or you wonder, why does it take months to see a specialist? Or why isn't that piece of equipment available now? It's like,
Yeah.
It's not just annoying, is it?
No, not at all. These are symptoms of, well, a massive administrative load. Endless paperwork, typing things in manually, just the sheer logistics of it all.
It's a headache for us, sure, but it's a monumental drain on the whole system.
Absolutely. And this isn't just, minor stuff or a few frustrating phone calls. These inefficient processes, they're a huge hidden cost.
Yeah.
They're actively pulling money and, importantly, people, nurses, doctors, support staff, away from actually caring for patients.
Right, away from healing.
Exactly. And what's really fascinating now is that AI, it isn't some far-off dream of robot surgeons. It's already here. It's tackling these mundane, everyday challenges. And the results, they're surprisingly big, and they're happening right now, reshaping how hospitals run.
Okay, let's unpack this then. First up on our AI efficiency tour, something we all deal with, sometimes with a bit of dread, scheduling appointments and paying bills.
Front lines, in a way.
Yeah. It sounds simple, right?
Okay.
But behind the curtain, it's this tangled mess of insurance codes, who's available when, what the patient needs. So, expert, the idea of AI handling billing, it feels like it could, cause problems.
That's a really fair point. People worry about errors, impersonality.
What are the big hurdles for AI here, and how is it really making things better?
Okay, so the main challenges are, first, the sheer volume of transactions. Then you've got historical data that might be inconsistent. And of course, you need absolute accuracy. Mistakes are costly.
Can't mess up billing.
Right. But this is actually where AI, especially machine learning, really shines. We're seeing intelligent systems optimizing appointment calendars, not just for one doctor, but across whole hospital networks.
Okay.
Making sure every room, every specialist, every machine is used efficiently. That means fewer empty slots, less wasted time.
Which means shorter waits for us.
Exactly. Shorter wait times to see that specialist. And it's not just getting you in faster. AI is automating claims processing. Think about that task. It's huge, prone to human error.
Oh, I bet.
AI cuts down the manual work, meaning faster processing, fewer delays getting care approved. And here's a big one. It spots billing errors before they even get sent out.
Before they reach me or my insurance.
Yes. So it's not just saving you that annoying phone call. The data we looked at suggests this can cut overall administrative overhead by, get this, up to 30%.
Whoa, 30%. That's not just tweaking things. That's huge.
It's a seismic shift, like you said.
Imagine an AI catching that coding mistake before it even leaves the hospital. No confusing explanation of benefits 6 months later. So what does that 30% saving really mean for patient care? Where does that money actually go?
That's the million-dollar question, or maybe the billion-dollar question.
All right.
Yeah, that 30%, it's a game changer. We're seeing examples where hospitals are redirecting those savings to, say, expand mental health services in areas that really need them.
Oh, wow. Okay. That's often underfunded.
Exactly. Or they're investing in better patient education programs, things that help people manage their conditions at home and don't get readmitted. That's a massive win for everyone.
Yeah, keeps people healthier and saves money.
It's fundamentally shifting resources. Less on paperwork, more on people.
That really brings it home. Connecting admin savings to actual community health. Okay, so speaking of vast amounts of information, let's talk patient records.
The data mountain.
Right. Hospitals generate tons of data daily. And it's not just neat spreadsheets, is it? It's unstructured clinical notes, doctors' observations, handwritten stuff sometimes, dictated summaries, kind of the story of the patient.
The narrative, exactly. Rich, but messy.
So how does AI make sense of that? All this raw, sometimes subjective text. What's the challenge beyond just like reading the words?
This is where something called natural language processing, or NLP, is just, well, critical.
NLP.
It's not just keyword searching. It's about understanding the meaning. It'd have to deal with medical jargon, abbreviations, even doctor shorthand, and those subjective observations.
Things a simple search wouldn't catch.
Precisely. AI using NLP can read and actually understand human language, grasping context and nuance. It mines these unstructured notes, pulling out crucial insights that, honestly, humans just couldn't find quickly, if at all, given the volume.
It's impossible to read everything.
Right. So this capability, it boosts decision support for doctors. It can flag relevant info instantly, maybe spot subtle patterns suggesting early disease, or catch a potential drug interaction mentioned in passing in a note.
Wow.
And for research, it's huge. It can identify patterns across thousands, millions of patient records, patterns that might have stayed hidden otherwise, maybe for decades.
That is mind-bending. So it's not just reading, it's understanding and connecting dots, like having a super researcher reading every note ever, looking for clues.
Kind of, yeah. It feels like science fiction, but it's happening.
It really makes you think, what if every patient's story, like every detail in those notes, could immediately help find the next breakthrough or just improve care for the next person?
That's the potential power of NLP here, connecting individual care to advancing medicine itself.
Okay, and sticking with this idea of the whole system, beyond the data, let's talk about the physical hospital, running the place.
The logistics.
Yeah. Beyond patients and notes, a hospital is this massive, complex machine. Staff, supplies, equipment, everything needs to be in the right place, right time. It's like navigating peak hour traffic in Mumbai.
Or LA.
But with leaves on the line, zero room for error. How does AI manage that logistical nightmare, making sure you don't run out of sterile gloves or can actually find a surgeon when needed?
This is where predictive analytics really comes into its own. Another AI application that's, frankly, amazing.
Predictive analytics.
So AI systems chew through massive amounts of historical data admissions, flu season trends, surgery schedules, you name it, and current trends, too. And they use it to forecast what's needed.
They predict the future, sort of.
In a very practical way, yes.
Huh?
They predict staffing needs for different departments, like with surprising accuracy, making sure you have enough nurses, doctors, support staff.
So less chance of being critically understaffed during a rush.
Exactly. Or overstaffed when it's quiet, which also saves resources. And it does the same for inventory, making sure essential supplies, those gloves, specific drugs are always there. No shortages.
But also not wasting money by overstocking things that expire?
Precisely. It optimizes inventory levels. And it even manages equipment availability, making sure vital tools are ready to go, cutting down delays. It's like an intelligent nervous system for the hospital.
Oh.
Anticipating needs before they become problems.
Okay, that is huge. A super smart operations manager working 24/7, predicting what's coming. How does that directly impact patient safety, though? Can you give me like a real scenario?
Sure. Think about a busy ER.
Okay.
Without AI, maybe there's a big accident, a sudden rush of patients. They could quickly run out of certain trauma supplies or just not have enough nurses on hand.
Chaos.
Right. But an AI system, it's constantly monitoring patient flow, bed status, maybe even local news or traffic alerts. It can flag that a surge is likely and signal before it hits to call in extra staff or restock specific kits.
Proactive, not reactive.
Exactly. Preventing critical delays and getting life-saving care. It lets the humans focus on the patients, not scrambling for resources. That's a direct line to better safety and quality.
That makes perfect sense. No more running around looking for stuff. My stress levels are lower just hearing about it.
It's a big deal for the staff, too.
So if we zoom out again, look at the big picture. All this AI automation in the back office, scheduling, billing, notes, supplies, the impact seems, well, profound.
It really is. Healthcare organizations can just operate leaner, smarter, with more foresight, and they can take those big cost savings, remember that potential 30% cut.
Yeah, the 30%.
They can plow that directly back into patient care, into expanding access, maybe funding that next research project. It's not just about efficiency for efficiency's sake.
It's not just saving a buck.
No, it's about fundamentally changing priorities, shifting resources towards what really matters. Better health outcomes for everybody, and pushing medical science forward.
So what this all means for you and me, the patient, is this invisible AI work. It's not just saving money somewhere up the chain. It's letting doctors and nurses do their jobs better.
Mm-hmm. Giving them more time, better tools.
Yeah, freeing them up to actually care for us. And it's funding the next generation of treatments and cures. It's like a virtuous cycle, right?
Yeah.
Started by smarter admin.
A virtuous cycle is a great way to put it. Making the whole system work better, from that first appointment call to the final bill.
Okay, here's a little something extra to think about. A hidden bonus for those listening closely.
An Easter egg.
Kind of. If AI can spot billing errors, optimize staffing, predict supply needs, could it eventually, design the perfect hospital layout, optimized for how patients move, how emergencies flow?
That's a fascinating thought. Using data to design physical space for optimal care.
Or even predict health crises in a whole community before they happen, just by analyzing admin data like appointment no-shows or maybe what supplies are suddenly in demand.
The predictive potential based on these operational efficiencies is really, really interesting. Where it could go next, it's kind of mind-bending.
Totally. The possibilities just spiral out from getting the basics right. Okay, so let's do a quick recap of our deep dive today.
That was good.
We've really explored how AI is this engine for administrative efficiency in healthcare. It's changing everything from how you schedule appointments and how claims get processed, potentially cutting those admin costs by up to 30%.
Which is huge.
Huge. To using sophisticated NLP, natural language processing, to find these critical hidden insights in doctors' notes.
Unlocking value from unstructured data.
And even intelligently managing the whole hospital operations staff. Supplies using predictive analytics. These aren't small changes.
No, these are fundamental shifts.
Making healthcare leaner, smarter, and ultimately just better for all of us. More resources going directly to patient care.
It's the bottom line.
So if you thought AI was just, self-driving cars or those chatbots you argue with, today proves it's also the silent hero making your hospital visits smoother, maybe your bills clearer, and your actual care better. But admin efficiency, as important as it is, it's just one part of the story.
Just scratching the surface, really.
Exactly. Next time, we're tackling something maybe even more mind-blowing. How AI is directly helping doctors with groundbreaking diagnoses and creating personalized treatment plans, making things possible that just weren't before.
Right there in the clinic, with the patient.
You really won't want to miss how AI is literally changing the future of your health right in the examination room. So make sure you're subscribed, follow us, whatever you need to do so you don't miss that next deep dive into the real cutting edge of medicine.